Thank you, Mr. President.
Thank
I'm
you.
very happy to see you.
I'm happy to see you all.
So, Mr. President, welcome to the Washington, D.C. VA Medical Center. We're so excited to have you not just visit this medical center, but visit veterans in your term and see our vaccination effort. I do want to introduce some members of the team. Dr. Deepika Duganini is a clinical pharmacist here on our staff, and she has been working about 6 days a week, sometimes 7 days a week, since middle of December. Drawing up vaccine and leading our team that does that. Here we have Lieutenant Colonel Sharon Tatiana, a retired Army Nurse Corps officer, who is receiving her second dose of Pfizer today. Her vaccinator is Dr. Nikki Garaya, our Deputy Chief of Staff, but Nikki has also really headed our testing capability here, running a respiratory evaluation center that allows us to test both veterans and our staff, and veterans who are coming here for pre-procedure testing. They have surgery. Done a wonderful job. Here receiving his first dose of the new J&J vaccine is Staff Sergeant Marvin Cornish, United States Army.
Sarge, how are you, pal?
Well, sir, thanks.
And the vaccinator is Denis Bain. Denise is our Associate Director for Patient Care Services, our nurse executive. But more importantly, in this environment, Denise has been the Department of Veterans Affairs representative to Operation Warp Speed since November, working to make sure that VAs across the country get the allocation that they need to take care of their veteran population.
You're really warping the speed now.
Thank you, sir.
So, and then lastly, Colonel retired Margaret Cope, United States Air Force, is receiving her second dose of the Pfizer vaccine today. Her vaccinator is Dr. Leslie Rowan, who has been our vaccine coordinator here at the Washington, D.C. VA, responsible for nearly 28,000 doses of vaccine going into the arms of our staff, our veterans, and 5,000 of our partners at the Department of Homeland Security.
Thank you. Thank you, thank you, thank you.
So, sir, what we'd like to do now, Amy, explain to you how we mix up and draw the Pfizer vaccine, and how long before the guidance came out to get 6 doses out of a bottle, Deepika and her team were getting 6 doses out of about 95% of the vials.
God love you.
Thank you. Yeah, so basically, the Pfizer vaccine comes in a vial like this,
Yes, I know.
and then it's a concentrated liquid, and we dilute it with 1.8 ml of sodium chloride. And then we draw into syringes like this, 0.3 ml each. And then we note everything down here, and if anything's missing, like 5 dose, 6 dose, we have to report to CDC. So we maintain this log. So that means,
Excuse me 1 second. Where is Jeff Steins?
okay.
I think he snuck in the back. Mr. President. He's right back there.
Oh, there he is.
Jeff, come up here a second. I want you all to meet Jeff Steins. Jeff is the guy who had the dubious distinction of my asking to put together the entire team. And Jeff is, he also handled, along with some others, Ebola in our last administration. But I just wanted to see Jeff. Jeff's the guy doing a lot of the work.
Thank you.
Under your leadership and with an unbelievable team. Thank you.
Thank
All right.
So I start every day at 4 a.m. So I'll be ready with as many doses as I can by sometimes 6:30 and sometimes 8 a.m. So I practiced a lot.
You get up earlier. I mean, 4 a.m., that's kind of late. God love you.
So I take it before I draw, and then I have to take. So I have to do 1.8 ml of sodium chloride.
There you go.
Point 3 ml. I played with bubbles all day.
Now, you prepare all of these?
I have I have other people helping me. So depending upon the volume for the day,
Yeah.
we plan, and we are sometimes 2 people, sometimes we went up to 5 people. One day we did like 1,200 doses. So
That's wonderful.
4 other people helped me do all the drop all the doses.
So we have a team of, it's between 2 and most days it's 3 to 4 that are drawing up. For example, today we have 537 vaccines scheduled across the day. That's a good day's work for 3 pharmacists.
Yes.
Yeah.
And how did you handle the weekend with 1,000?
When we do 1,000 to 1,200, we have 4 to 5 pharmacists that are working from about 6 in the morning till about 3:30 in the afternoon drawing the vaccine. The day we did 1,200, we actually had to pull in 2 extra pharmacists because we had more people vaccinating than we had. We normally have about 25 vaccinators when we're doing a weekend clinic. The day we had 1,200, we had 38 vaccinators. So we were going through vaccine a lot faster than
We
the
tried to-
pharmacists were used to.
Yeah, we try to be ready with 200 doses. So the first few hours will be really quick because there are always so many vaccinators, more vaccinators than the people who are drawing. So we have to compete with them. So so far we are doing great.
We're doing pretty good across the country.
Yes.
We're going to reach 100 million doses pretty soon.
Yeah.
But we have to focus more on getting to the neighborhoods that are at-risk neighborhoods.
Well, I think that's where Johnson is going to help.
Yeah, boss can speak more to it, but when we spoke with Johnson & Johnson, there was a little difficulty of them being able to have the facilities to produce it. So this guy got a hold of Merck and put them together and did something that's unusual these days. Put together 2 competitors to help save lives, and they're doing it. And then the same with regard to a couple of others that needed some help in terms of lacking equipment for their manufacturing. So we were able to get that done. So I learned from running the Recovery Act, you got to be hands-on. You got to get down to the detail because it really matters. I think Jeff put together a hell of a team, and so we still have to, one thing to have efficiency, we have to have equity as well, making sure neighborhoods are covered. But you're covering the gambit here. That's impressive.
Thank you, sir.
Okay.
So this is how we draw all the doses.
Yeah.
And then we label it with 6 hours of window. And
Okay.
these are the labels.
I take my coat off, except I've had my 2.
As soon as she finishes drawing them up and labeling them, we'll give them to the vaccinators.
Yes.
Denise, do you have a J&J one there for?
I do.
Sergeant
That's the
Cornish?
first J&J dose.
Oh, wow, the inaugural.
Yes.
The first one here?
Yes.
All right, you get 1, man. Sarge, I tell you what, no,
I'm an only child, so.
I tell you what. My son's Army, he got promoted to major after a year in Iraq. He said, I said, hey, you're a field grade officer now, pal. He said, no, Dad, I have no lieutenant who runs the Army. Master sergeants, they run the Army. All you colonels, you get that straight. I know you know that. But anyway. All right.
And it's important she labels them because 4 of those doses are going to go down to our vaccination clinic and into arms of one of those. I think we had 388 second doses scheduled today with the Pfizer vaccine. So,
Yeah.
Thank you.
Now, is this your first or second?
Second.
Second.
And then I logged in this, just before we came, I logged in, and then we
All
tallied
right.
the first dose and second dose and of the day.
Okay.
and so, sir, on your order, they can vaccinate.
Go ahead.
All right.
What? I spent about 7 months as a patient at Walter Reed, so I'm used to getting shots. Go ahead, fire away.
So then we verify, we make sure that every person gets to see what the vaccine, what it's labeled for their fur. And then we verified all their information. We put the information on their card for them. We circle it here, and then we'll take this back to the computers and put it into the computer electronic record system.
And so once we enter it into the electronic medical record and Leslie signs the note, the data automatically gets transferred to the Centers for Disease Control so that they're able to count it.
And then we tell,
Yeah.
remember to take a picture of your card. Don't laminate it, put it in a baggie. So in case we have to give you a booster shot, we can still use the same card.
Yes, I'm sure, and I heard that this might be a first travel, so.
The other thing with this shot is you might get a few symptoms.
I'm not allowed to do it.
But you should be okay.
Thank you, sir. Also, 2014, I was your MC at Veterans Day.
Oh, is that right?
National Cemetery. I thought you recognized the bald head.
Well, I didn't recognize the mask, though, man.
Yeah, so I had that honor 2013 until 2016.
Proud of you.
Thank you.
It's great to meet you, sir.
Nice to meet you. Thank you. As soon as I get it.
Hey guys, let's go, let's go, thank you guys, let's go, guys,
Can't
thank
do
you.
it the normal way. Let me do one like this.
Thank you guys, let's go, move out, let's go, guys, let's go, let's go, let's go, thank you.
Mr. President.
Let's go, you guys, thank you. Let's go. Let's go, you guys, out the door, let's go, guys.
Thank you. Thank you.
Come on, guys, let's go, out the door, let's go.
Hey, how you doing?
How are you?
Good.
How are you?
Long time no see.
How you been?
I've been good. How about you?
Stay healthy?
Oh, trying to.
Perfect.
Thank you, sir.
You're welcome, sir. Sorry about that kick. I didn't see it. My mixer's in the way. And there was no room to move.